So Colchester Hospital is a £250 million organisation, and we've got a headcount in terms of total staff of something circa 4,000 members of staff in the trust. As an organisation, we had a very sort of challenging time in that we had issues around the accuracy of numbers, the visibility, the transparency of numbers, and we invested amounts into other solutions, but quickly found that those solutions were very difficult to rapidly deploy really quickly. In terms of cost of deployment, they were quite expensive as well. Even though their licensing model was very simple, it wasn't as simple as you would have thought. That led us to for the need for a very different solution, a very sort of capable, agile, user-focused kit, but also something that would help us to manage those costs and deploy rapidly, i.e. ClickView. In terms of where we've seen the biggest gains though, with something like ClickView, I must say that it is around mortalities. So we have seen a reduction in the number of actual crude mortalities month on month within the organisation. It would be wrong of me to say that that is purely due to a bit of technology. That is not true. However, without the visibility, the agility, the flexibility of the tool, so being able to click on one number and seeing the patients that sit behind that number in seconds, without that functionality, I would also argue that it would be virtually impossible to shift that position. In terms of on a more, well, not even more, on a slightly different scale, I would argue, the treatment of cancer patients. So in the National Health Service in England, there are several different cancer standards. One of those standards is monitored by the regulator who regulates trusts who are allowed to operate like businesses, so foundation trusts, for instance. And one of their key measures of either sort of governance success or failure is an organisation's ability to consistently treat cancer patients within 62 days, as in full treatment. And as an organisation, before I can recall it very vividly, we would send out tons of spreadsheets every single week, not even every day, every week or every month sometimes, to give the organisation a position on cancer. However, what ClickView has allowed us to do is several things. One, we have built the entire suite of cancer standards into an application which refreshes every single day. So every day the organisation has an understanding of where we are in terms of our performance on every single one of those measures, how many patients are being treated within a set standard. But also we've gone 10 steps further, whereas before we couldn't bring in stuff like how long is it taking for cancer patients or oncology patients to have a diagnostic test. We're now able to bring that into an application so you can see the full gambit of that patient pathway. But one of the biggest things that I think the organisation have done around cancer is we have created, as opposed to only wanting to deliver the 62-day standard, we've thought less quickly and easily in ClickView, replicate that 62-day standard and change the standard to a 48-day standard, because we want to see patients a lot faster, a lot better, and give patients a better outcome at the end of it. Finally, you've got the 18-week measure, so the referral to treatment within 18 weeks. Now, we have seen a palpable shift in the performance around those measures, because hospitals are penalised if 90% of their patients are not financially penalised and not treated within set periods within 18 weeks. So at the moment, I think we're one of the only people across the country that have got an application of that complexity and magnitude that allows the organisation to not only look at patients within every single pot, i.e. within every week bracket, but also try to forecast the volumes that will come in so that we can manage that demand against our clinical capabilities and our sort of capacity within the organisation.